Planning for emergencies. Saving minutes to save lives. No one plans to have an emergency. It just happens to anyone, anytime, anywhere. But everyone should know what to do when an emergency does happen. Before an emergency happens, you should know basic first aid and cardiopulmonary resuscitation, or CPR. In any emergency situation, the best place to call for help is 911. 911 is the single emergency telephone number in the Twin Cities metro area for police, fire, and medical emergencies. By dialing 911, help is just minutes away. 911 telephone stickers should be placed on every telephone in the home, and children should be taught how to dial for help. When calling for help, it is important to stay calm, speak slowly and clearly, give the exact location of the emergency, try to explain the problem, give some basic information about the patient's condition, for example, trouble breathing, chest pains, and most importantly, do not hang up until you are told to do so. While you are waiting for help, it is important to stay calm. Don't move the patient unless his life would be in greater danger if you did not. Don't give the patient anything to eat or drink, and reassure the patient that help is on the way. When the 911 public safety answering point receives a call for help, it'll be immediately dispatched to a fire, police, or ambulance unit. According to Emergency Medical Services guidelines, help should be at the scene within 5 minutes. In some situations, police or firefighters may be closer to the scene than the ambulance. They will be dispatched along with the ambulance. Both have been trained in basic first aid and CPR and can provide some help until the ambulance arrives. There are 2 types of ambulance services: basic life support, or BLS, and advanced life support, or ALS. Not all areas have ALS. Where you live, or the type of emergency or call for help, determines which ambulance is dispatched to the scene. Basic life support ambulances, or BLS units, are staffed by emergency medical technicians, or EMTs. These people are trained to recognize dangerous and potentially dangerous life-threatening conditions such as cardiac, respiratory arrest, or severe bleeding. For example, if a person is choking, an EMT can help that person breathe easier and give them oxygen. An EMT also knows how to control severe bleeding by applying pressure and how to perform CPR. EMTs work to prevent any further injury to the patient and transport the patient to the hospital. Part of the EMT's responsibilities are proper lifting and moving techniques, as well as splinting fractures, monitoring vital signs such as blood pressure, pulse, and respiration, and calling ahead to the hospital about the patient's condition. The other type of ambulance service is advanced life support, or ALS. The people at this level are health professionals called paramedics. They are skilled EMTs with advanced training. Paramedics can start IVs, or intravenous fluids, administer drugs, listen to and interpret heart and lung sounds, monitor heart rhythms, and other advanced emergency procedures formerly performed only in the hospital. The care administered by the EMTs or paramedics at the scene is generally done with instructions from a doctor over the radio. This is one way doctors and hospitals provide medical direction to ambulance services. Medical direction includes being responsible for the quality of care provided by ambulance services. Quality is maintained by doctors and nurses who help to train EMTs and paramedics. Both require a certain number of training sessions and periodic certification. Continuing medical education both in and out of the hospital is a very important aspect of the EMTs and paramedics training. Another way of maintaining quality of care is that a doctor always reviews a record or report of each run an ambulance service makes. This way, the doctor checks to see if the EMTs or paramedics are receiving good instructions while at the scene, and if they have appropriately carried out doctor's orders. But directions for providing over-the-radio at-the-scene medical care to the EMTs or paramedics is one of the most important services the hospitals can provide. St. Paul Ramsey Medical Center provides medical direction to 15 ambulance services in the East metropolitan area via the radio. Divine Redeemer Hospital in South St. Paul provides medical direction to its own ambulance service. Hospitals are a vital link to ensure quality emergency and ambulance services for your community. The hospitals involved in the system must have the ability to care for the critically ill and injured patient. Since care for the critically ill and injured patient is expensive, only a small number of hospitals are equipped to provide that type of care. Emergencies require doctors trained in many specialties as well as special equipment, emergency medicine departments with physicians who specialize in emergency medicine, surgeons immediately available to the hospital 24 hours a day, and critical care centers for burn, neonatology, and cardiac patients. Radio communications between ambulances and hospitals allow doctors to give directions to paramedics at the scene for medical care. However, the current radio system in the East Metro area has had some major problems. The ambulance services often are unable to receive a clear, uninterrupted radio signal. The radio system is also used to transmit the patient's heart signs. The doctor needs this information to be able to instruct the paramedics properly, and any interruption of the signal affects the doctor's ability to give proper directions for at-the-scene care. In an emergency situation, this can pose many problems for the EMTs or paramedics at the scene, and loss of contact with the physician could affect the patient's medical care. It is also important for the hospital to be in contact with the ambulance, so that the staff at the hospital can prepare for the patient's arrival and notify other special services such as cardiology or the burn center. Because of these problems, a new radio communication system has been developed. This new system, which has its radio control center at St. Paul Ramsey Medical Center, provides the East metropolitan area an up-to-date, efficient hospital ambulance communication system. The center is called the Medical Resource Control Center, or MRCC. The new system covers Dakota, Ramsey, and Washington counties, an area which stretches from Forest Lake to southern Dakota County and from St. Paul to the St. Croix River. The benefits of the new radio system are a more reliable radio signal, which will maintain clear and uninterrupted communications. The geographic coverage area, which will be increased 3 times. While the old radio system only covered an 8 to 10-mile range, the new system has a 20-mile radius. A more effective means of coordinating a limited number of radio channels. This will ensure that a channel is available for an ambulance when it is needed. This new radio system provides the advanced technology needed to support the development of additional advanced life support ambulance services in the East Metro area. The radio system has been in the planning stages for the past 5 years and is an $800,000 project, with $650,000 being provided with federal funds. The system is owned and operated by the EMS Radio Joint Powers Board of Dakota, Ramsey, and Washington counties. The EMS Radio Joint Powers Board is an organization which was developed through a legal agreement between the 3 counties and has a governing board made up of commissioners from each county. The 3 counties provide the ongoing costs of the system. The equipment was purchased with federal grants through the Metropolitan Council, the Minnesota Department of Health, and the Minnesota Department of Public Safety, and with funds from private foundations. The ambulance services and the hospitals have paid for their own equipment. There are 4 basic elements to the system: ambulance radios, radio transmitters receivers, microwave links, and the MRCC. In each ambulance there is a radio, plus portable radios which the EMTs and paramedics can carry to the patient. The radio allows those at the scene to talk to the doctor at the hospital and send electronic signals that describe the patient's heart activity to the doctor. This is called telemetry. The transmitter's receivers relay the information between the ambulances and the MRCC. The transmitters are located in downtown St. Paul, Oak Park Heights, and Burnsville. The microwave links provide a pathway for the radio signals from the transmitter's receivers to the MRCC. The microwave relay points are in Maplewood and Invergrove Heights. The MRCC is like a traffic cop and is the hub of the system. Paramedics staff the control center 24 hours a day as operators. The operators assign the radio channels to the ambulance units as needed and make connections between the ambulances and the hospitals. These special medical control points are at St. Paul Ramsey Medical Center Coronary Care Unit and Divine Redeemer Hospital. Divine Redeemer Hospital is the medical control point for its own ambulance service. MRCC is the central medical control base and will relay information concerning emergency patients being transported to receiving hospitals. The operator can coordinate many ambulances when the emergency or disaster requires more than one unit. Here's how the system works. The ambulance unit responds to the emergency. While the ambulance is on its way to the scene of the emergency, the EMT or paramedic radios the operator at MRCC and asks for a channel. The MRCC operator assigns the ambulance unit a radio channel. The unit arrives at the scene of the emergency. Communication between those at the scene and the doctor at the medical control point begins. The doctor receives information about the patient and prescribes the care. The ambulance takes the patient to the hospital, while the MRCC operator notifies the hospital of the patient's arrival. The patient arrives, and the doctors and nurses are ready. When the ambulance arrives at the hospital, the radio channel is then given up and ready for the next emergency. The EMS communication system is one way that communities, hospitals, and ambulance services are all working together, saving minutes to save lives. Better communications among those who respond to emergencies on the street and those who care for the patients at the hospital improves everyone's ability to recover from an emergency. Emergencies just happen. Quality emergency medical services have to be planned for. The Emergency Medical Services Communication System is one way your community is planning to help save lives.